and the Prophet already guided us. So our dear viewers, in such a situation, Muslims and non-Muslims, we advise you that we follow what the government is telling us, since we are allowed, we are supposed to follow our leaders, and also we follow what the health experts are telling us. Put on your face masks, observe the social distance, and wash hands. That is what our Prophet told us, to do preventive measures. Thank you very much. That is my input so far on the pandemics. On the pandemics? Yes.
Okay. Yes, Dr. Ali, you've heard from Dr. Isa and his submission on the pandemic. I am very much aware that he still has a lot in his midst to share with us. But also I want to invite you still in context to really share with us what you have as a package on the contemporary complications.
Yeah, our Islamic Sharia, one of the major issues in our Sharia, in our law, is preservation of life. And when you look at all the measures that my brother has talked about, that the Prophet sallallahu alaihi wasallam gave this ummah, partly is preserving people's life. In that if you are already affected, if you are infected, you have to keep in the place where you are so that you don't infect the others. It is a very, very crucial point for the Muslims, because our nature of worship, praying, you know, we tend to congregate a lot. Of course, there is a lot of rewards that encompasses praying in Jama'ah, praying in congregation, and so it is a very, very important factor in our religion. But then also, in view of protecting others, it is very, very important to actually, the Muslims in the first place, it is very important to protect ourselves and also protect others. One of the contemporary issues regarding the COVID now and other pandemics is the issue of vaccination. There is some people actually, I think the world of Islam has moved a step as far as vaccinations are concerned. I remember even here in Uganda, there was a time when the Muslim world were actually hesitant to take the medication, the vaccinations for the children, the killer diseases. Actually, some of our Muslims were affected, the babies were affected, but that was partly because there was a lot of misinformation regarding the Islamic view of vaccination.
Okay.
And now here the pandemic comes, very many people, Muslims and non-Muslims, are hesitant to go and get the vaccination for COVID. Particularly for the Muslims, some of them, some of the issues that have been brought about the vaccine for COVID is that people are not aware, they are not sure of the ingredients in the vaccine. And what Islam guides is that for as long as the ingredients in the vaccine are halal or are acceptable in Islam, then the vaccine is okay. People have talked about the vaccine having some components of the pork. But one of the ulamas, I think it was Sheikh Jibra'in, he guided and said that even if it was true, we are not saying it is true that there is a component of pork in the vaccine, but he said even if it was true, the pork, by the time not injected, that it goes through, by the time it is actually called a vaccine, this is no longer pork. So the main contemporary issue that has been rotating around the vaccination program and vaccines is the issue of what has actually been, those vaccines have been made out of. But the Sheikh's guide that for as long as the vaccines have been made out of things that are acceptable, then the vaccine is okay to be used. So now I would take you, the Muslims. Like my brother Dr. Isa said, it is true we are in the second wave. The wave of COVID is real. For us who visit the hospitals, we know what is actually happening. Today I was in Naguru hospital and almost the isolation unit is full. All the hospitals are chasing patients. So actually the doctor was telling one of the patients that if you actually don't comply, there is no other hospital that is going to allow you. So we encourage people, we encourage our Muslim Ummah, please, you go and get the vaccination. There is nothing wrong with it. First of all, you are preserving your life, and you are also preserving the life of the Muslim community and the community of the other people where you live. And Islam is absolutely against people infecting others. There is a hadith where the Prophet ﷺ has said that la darara wa la dirar. It is not allowed to cause harm to yourself and also causing harm to the others. So if you don't vaccinate yourself, you get COVID, it's already a harm to yourself. And then you are also going to transfer that harm to the colleagues. So I urge you, my Muslim brothers and the other people around the community, to please embrace these programs. When you have a chance of getting vaccinated for this COVID-19, please do get that vaccine. There is absolutely no problem as far as Islam is concerned.
Okay, thank you so much. I've actually witnessed a lot of laxity in the mosques. People are beginning to wear off the face masks. People have begun, shaking hands, hugging in the mosques. There's a lot of laxity in the mosques, as if it has vanished, and yet it's still within our midst. I think the imams really have an obligation to style up and ensure that the congregants, are actually compliant with the SOPs.
Yeah. Sure, I think it is at this moment that we would like to appeal to our Muslim leaders. For sure, the laxity has been not only in the Muslim community and not in the mosques, but almost everywhere we go. You see people on the roads, when you go to the markets, people have taken life as usual. I mean, it's like we've forgotten about the SOPs and all that. But I think it is the imams, like you said, have a very important duty to play in this. If it actually means enforcing people to put on masks, we call on the imams to do that. Can even put someone on the mosque way, and you don't allow anyone to enter the mosque without a mask, because for now that is the first, if I may say, the first line of defense that we have. Okay. It's the first preventive measure that we can have. Because remember, when you put on the mask on the sujood, where you go, I mean, if you've not put on a mask, at the point where you are going to prostrate, if you have the virus, you are going to leave it there, and it stays there for around 9 hours. Then it means every person that is going to prostrate in the same place is going to go with the virus. So within a short period of time, every person that comes to the mosque is going to have the virus. So it's very, very important at this point. We are calling upon our Muslim leaders, please, this is real, and you have a very important role to play in protecting
Dr. Isa, as we go away from that, there is quite a lot that is trending on social media, that whosoever is vaccinated has only 2 years to bid farewell.
I think that is...
How true is this, and what is your comment as we...
I think, as my brother has already commented, I think that is not true. The virus, the vaccine we are using here is very safe, and there are a lot of misinformation that is going around that it will affect your DNA. Let's say if you use that one for Pfizer, even AstraZeneca, it has a virus which is a helper. It carries the messenger RNA of this vaccine to place in the cells where it multiplies and it increases your line of defense.
Okay.
Scientifically speaking, it is not true that people are having only 2 years. So I think our community should really improve and go and find right information from the right sources. Okay. We have the Ministry of Health, and I would want to urge the Ministry of Health that we should go on to do public health talks to the community, because there is no way we can be keeping quiet as misinformation is going on around the community.
Okay.
So in order to counteract the misinformation, we have also to give in the right information.
Okay.
And I wanted to submit something, what my brother was talking about in the masjid and the prayer places. You know, I happened to pray in a certain mosque. It is very absurd. People were social distancing, but they were putting on fans around, and I've been seeing a lot on TVs, even in churches. That is what is happening. You social distance, but you put on fans. Some are not having masks. So as long as you're putting on a fan, remember the president told us very well, now the fan will act as a carrier. It will carry the vaccine to the people who are, even if these masks we are not, the masks we are using, the surgical masks and the ones for clothes are not 100% protective. So they prevent a certain percentage from reaching you. Okay. But we need really to, our sheikhs, the leaders, need to improve on that. And for us, the Muslims, we need to tell our people to come with prayer mats. You come with your own prayer mat. I think the National Mosque is guiding on it very well.
Okay, thank
Maybe,
you.
Sheikh, there is something that I have been thinking about. One of the things I think that has let us down is the misconceptions and the negative campaigns against the virus. I mean, against the vaccination, first of all, and also against the virus. There are people today that still actually don't believe that the COVID is there. You know, so I think it is a very important point that my brother raised. There is, what you see most circulating is the negatives. We don't see the positives.
Okay.
I think it is very, very important to also start circulating the positive messages against, you know, those negatives that are being raised.
Okay, thank you so much. Yes, Dr. Issa, yes. What other message would you like to share with us regarding the contemporary health issues?
As we are starting, I talked about the issue of artificial fertilization. Our community here as Muslims, and of course the non-Muslims, we saw it has been going on here in Uganda. There is women's hospital, now government has come in, but Islam always has a direction on what to discuss, on what to do. So as you can see, there are a lot of issues. One, Allah promised us, Allah told us in the Quran that one, He can decide to give you children, He may not give you children. And in the children He can give you either females only or males only.
Or mix.
Or He can mix. So to some of our people who are not blessed with children early, it is a great test. And they run to seek ways of how to take away this problem. So that is how medicine is advancing, and that is how the women's hospital now, and maybe the women's hospital is coming in to help. But Islam has some issues on that. It is a contemporary issue in that if the man is having a problem, if the husband is the one with the problem, what are you going to do? Because one, if you have a problem and your wife has a problem also, they can get your sperms and the wife's sperm, the wife's ovum. They fertilize them artificially outside in the lab, and then they put the baby back in the woman's womb. Okay. That is very okay because it is between husband and wife, which is halal, which Islam accepts. But a moment may come for maybe we have seen this in celebrities. A wife can say, a lady can say, I want maybe a son or a child from a man. I don't want I want to be a single mother. I don't want my child to be anyone to be attached to them. So they go in the sperm banks, they get sperm from an unknown man, they put it in the uterus of the lady. So that is where Islam comes in. That is in Allah already stipulated for us where we are going to get children through husband and wife and through the halal ways. So when you get someone from out who you're not married to and then you bring in this baby, that is now where the problems are coming from.
A lady wants to have a mzungu like baby.
And then goes, finds sperms for a mzungu man. He gets his ovum, they do fertilization outside, or actually they can do artificial insemination and they give you the sperms. But now that baby, Islamic wise, Islam is not okay with that because it is outside the wedlock.
Okay.
Or there are some other people who actually come in. A husband is having, for certain reasons, medical reasons, a lady may not be able to carry pregnancy up to term. So she cannot have a baby, she cannot carry pregnancy up to term, up to 9 months. So they decide, husband brings the sperm, the wife brings the ovum, and then some decide to give it to another wife to carry, what we call the surrogate mothers. So that is where Islam comes in. You have involved in a third party. Even medical wise, we still have issues. Those are ethical. We know health wise, she's nourishing the baby. The placenta, all the nourishing is coming from her. So is it really yours? Is this for this mother? So that's how Islam comes in and tells you, stop. This is now not the prescribed way. Okay. So we advise our we advise our community that these modalities that are coming in are good, but please follow, find the right information from the right people. We have our sheikhs, we have the Islamic scholars, we have the medical doctors. So find the right place and do something that is allowed Islamically.
What I appreciate from this Sheikh Ali, Doctor, is that Islam weighs in. Even when it has queries on your advancement, naturally, it doesn't work out logically. Surely, like what doctor is telling us. Surely. But what's interesting is that Islam already, measures contextually to what is going on. It's not out of context completely, because there are instances where Islam gives you a leeway.
Yeah. Actually, to comment on that, I was reading a fatwa from Sheikh Uthaymin. And he also gave some little guidance on it. He actually even indulged in things of, is it really necessary or not necessary? Then he also even gave away how it is supposed to be done. First of all, it is supposed to be, when it is acceptable, it is, there must be a reason. Okay, like doctor explained. But then even the way it is done, it has to be done in an Islamic way.
Okay.
For instance, he brought to the issue of masturbation. So the man is going to donate the sperm. How is he supposed to collect that sperm? Should he go and masturbate? Islam doesn't accept masturbation. So he gives an example and is like, if it is between the married couples, they are married in an Islamic way, the man is not supposed to masturbate, but he's supposed to be intimate with the wife and then find a way of getting that sperm without doing the haram things. So the sheikhs have really indulged into these things. Then sheikhs also brings about the issue of who does it. If there is a woman to collect the egg from this female couple, the sheikh says if there is a woman doctor, then it actually should be the woman to collect it, not Dr. Isa, who is the gynecologist.
This is a very interesting discussion, but we've run out of time. I just wish to regret and ask your dear viewers that we shall have more interactions with our two doctors and sheikhs to share with us the contemporary issues
Maybe.
And what Islam speaks about that.
I just wanted, there is something I wanted
Yes, just
to
a second.
In 1 second, it is very, very important for our viewers these days. I have a couple that I knew, they didn't have a child for 3 years. And then the problem was actually medical. It could medically be rectified. They were 3 years married without a kid. Then when I advised them, the man had a problem with his sperm count, and the lady had a problem within her tubes. So when they went to the gynecologist, the man was given some medication to boost his sperms, and the woman was worked, his tubes were actually washed, if I may borrow that term. And now they are blessed with 3 kids. So people should actually seek medical attention, and not just sit back and laugh.
Inshallah ta'ala, thank you so much, our dear viewers, for watching this show, the Muslim Digest. I have been with Dr. Isa Semakula and Dr. Ali Tunamgisha. Till we meet next time, assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Thank you, our viewers.